is working as a team member in our office. He is working with me side to side. So he's a licensed massage therapist working with me. He does a prep work whenever the patient comes in. He helps patients to have a balanced muscle. He neutralizes the tension so that it's easier for me to work on their spine and adjust them. And adjustment after they're done with the muscle work by drill, their adjustment is likely to stay in alignment longer period of time. So that's why it is very important that we don't just adjust the joint alone, but we also work with the muscles. Because the reason why joints are out of alignment is because there are irregular muscle activities. So it's very important to balance those muscles. It's just going to be a more effective way of approaching the problem. And then we stabilize the joints by helping patients to do some form of intrinsic muscle strengthening exercises, which is pretty much available for majority of our patients. So all that muscle work as well as an adjustments and stabilizing toning exercises are 3 keys that all the patients go through in our office. The patients that are coming in here initially are the ones that are suffering with pain.
Some numbness in this area as well.
Wow, Trill already worked on this and it's still tight like this?
Yeah.
Oh wow.
Yeah, it's pretty tight.
Still bothers you?
It's still not, I wouldn't say it's constant, but it comes back pretty quickly afterward, and it seems to be persistent.
So whenever they are suffering with pain, their stage of condition varies. Some people came here after a sprained their ankle or hurt their back lifting things. And some people came here because of the problem they've been having for over 10-20 years.
So how do you feel right now?
Not too bad.
Not too bad?
Over 10-20 years they've been having lower back pain or neck pain off and on.
On a scale of 1 to 10, 10 being the worst, where would you place yourself right now? About a 4.
It is likely for their body to be having some type of compensation issue. Because of that chronic pain, their body starts to compensate to alleviate the pain. By doing so, their spine starts to turn and curve, and that's why we see some patients having spinal curvature like scoliosis, spine that's kind of rotated to different directions on an x-ray. And if you see that, we know they are likely to suffer with some type of chronic condition. So in order for us to re-educate those chronic condition, which is involved with muscle work as well as joint work, it is important that we adjust and treat those structures regularly in the beginning so we could be able to re-educate them as quickly as possible. Because of the memory fiber that we have in our cells, our spine has a tendency to go back the way they were before. It's been a while.
It has been, and right up in here I can feel it the last couple of days this week. I know I've been a bit, I really do. I have no reason not to come in here. I like to, I always feel better.
If the spine's been curved this way, even though we set them right, they have a tendency to go back out of alignment again, like a teeth, cricket teeth. It's important that we wear a retainer after we're done with braces. Same kind of concept. We have to readjust periodically to bring it to alignment. All these are evidence how our patient's spine gets to be realigned with an adjustment. So Kelly, tell the video how much of a headache you used to have a long time ago.
It used to be really bad, like every day.
For how long?
A couple of years.
A couple of years. And how often do you get headaches nowadays?
Once a month.
Once a month?
Yeah.
So aren't you glad that you got adjusted?
I am.
Pregnant ladies have problems in their pelvis a lot more than others. Usually because of extra weight in their stomach area. The ones who already have some muscle imbalance in their pelvic area, buttock area, lower back, then they'll have a little more problem in their pelvis. So pelvis are likely to go out of alignment. It's likely to get tilted. because of all that irregular muscle activities. So all that muscle work as well as an adjustments and stabilizing toning exercises are 3 keys that all the patients go through in our office. We do have patients do exercises in our office. If the patients are having too much of a pain and severe amount of inflammations are there, then we focus on controlling the pain as well as the inflammation first. Once that stage has been passed, then we have patients to start with beginner's exercise and then intermediate, and we'll change it to an advanced. Usually we change their exercise to advanced after they do not have any more symptomatic complaints, so that they could be able to continue on with very intense exercises at their houses. However, when we're talking about importance of exercise, it is going to strengthen the muscles as well as bony structures. So you're going to have extra bone density. There's no blood vessel going through these discs. All those discs as well as cartilages are working through imbibition, which is through membrane. So in order for this material, soft tissues, to have extra nutrients such as glucosamine, chondroitin sulfates to be withdrawn inside, there has to be some type of a pumping action. And we've been having very successful result with those.